It is Friday, June 19th. Joe Delaronde, you Jets. Welcome to the COVID-19 Task Force Daily Update on another gorgeous day. Hope you're enjoying yourself as we get set for a weekend that I hope will be safe and happy for everybody. On the program today, we have a couple of guests. One will be talking about the Kahnawake Memorial Hospital Center, but we'll start off the program with a little piece here on the reopening of events. As Kahnawake opens up, there are going to be more events, family or otherwise, that happen. And in order to meet the criteria set forth by the task force, Robyn Montour of the task force describes and gives us some information I think that is going to be very useful to many of you out there.
So if people are planning to hold an event in the community, some of the things they should consider are physical distancing, maybe some props to have in place to ensure that people are aware of the distance that needs to be between families, so the 6-foot distance props, maybe markings on the ground. They can wear masks if the distance cannot be respected. Maybe have some volunteers in place for crowd control. Informing any of the people that are going to be participating in the event that if you're sick or have any symptoms of COVID-19 that you should not be participating in the event and that you should stay home. Also, people from the same households can be in the same the same vicinity, but anyone else outside of your household has to be the 6 feet away. So they can just basically submit that to us, and we can help them with any questions that they may have. We can also have an inspector available if they have any questions and to help them with their plans. Well, we definitely want our inspectors to go over the plan with them just to make sure that they have everything in place. So it would be a good idea to contact us, and we can work with them to make sure that the event is as safe as possible for the community. Normally, if they come to us, we can advise the peacekeepers if necessary, if we need that extra precautionary measure in place. So it would just be dependent on the plan and how big the event is that they want to hold. So if somebody wants to organize an event in the community, they can contact Public Safety at 450-632-0635, or they can email us with any questions that they may have about organizing an event.
And thank you very much for that, Robyn. Very informative, and again, I hope you paid close attention to that. Coming up next, the Kahnawake Memorial Hospital Center is always a busy place, and with all of the changes that we've had over the past few months, some people still aren't sure about how they should make appointments and things like that. So coming up next, we talk about the clinics, the outpatient department, and making appointments at the Kahnawake Memorial Hospital Center. And to do that for you is someone that you've seen several times now on this program, Krissi Delaronde.
Patients are asked to call 450-638-3930 at extension 2220 or 2262 for appointments. And basically, if you're calling in to get an appointment with one of your physicians, it will consist mainly of phone consultations. If there is a need to see you in-house, the nurses and doctors are working together and they're establishing exactly who needs to be seen and for what reason. If you're calling in same-day appointments and you wish to see a physician for a minor urgency, we're asking the client to leave a message with the front desk. Basically, give all your information, telephone number, exactly who your physician is and what the need may be to come in, and the nurse is going to phone you back. She's going to do a small phone triage and determine with the physician whether or not it's something they can handle over the phone. And if they can't handle it over the phone and they need to see you in person, they're going to ask you to come in. They're also going to inform security so everybody knows you're coming in for an appointment. You are to have your Kahnawake Memorial Hospital Center card as well as your Medicare card all up to date. The front desk is where you're going to be checking in as per usual. You're going to be double identified name and date of birth, as well as any updated information for contact, telephone, and address. So we have the waiting area measured off for 2-meter distance to ensure safety of our clients. We do have a separate waiting area for Well Baby Clinic, as well as a separate area for our pediatrician and our prenatal appointments. So when you're expecting a phone call from one of the physicians for a phone consultation, we ask that you have all necessary documentation with you that you need to ask the physician any questions. Also, if you're doing any self-health checks, such as blood pressure, blood glucose, that you have all the information handy. The time you're getting phoned is at the doctor's discretion, so it could be any time in the morning all the way up into the evening. So we just ask kindly that you stay next to the phone number you required, and it may not say Kahnawake Memorial Hospital Center. It could say private number. It could be a different number of the Kahnawake Hospital. We have many lines, so we ask that you answer all phone calls, and it could be your physician phoning you. We would like to urge all our patients coming in to bring their own masks with them. Should the need arise that you need a mask to come in, the security guard will provide you with one, and you are asked to wash your hands. Also for our Saturday clinics, we are asking our patients to call in at 8:35 a.m. at 450-638-3930. That's at extension 2220. And the receptionist will take the information down and your telephone number and your name. You will be expecting a phone call right after that by the nurse. The clinic nurse will phone you, and she's going to do a small phone triage to see if it's something that the physician can handle over the phone. If not, you can come into clinic on the Saturday, and the same procedures as during the week follows. So if you do receive a phone call from the physician and they advise you that there is paperwork for you at the front desk, we're just asking if you could just wait until you receive a phone call from the receptionist stating that they have received your documentation at the front. They always will call and let you know that they have something for you. This way we can ensure it's at the front desk. So KMHC would like to welcome all our clients to phone us if there is a need. We would like to help you in any way we can, and physicians are just one phone call away.
Good job, Krissi, and thank you very much. Speaking of the Kahnawake Memorial Hospital Center, we've talked this week several times about the upcoming Father's Day drop-off for the fathers and actually for all the patients and residents over at Kahnawake Memorial Hospital Center. So we'll mention it again. Coming up on Sunday, going from 9 a.m. till noon, you can drop items such as soaps, things like that, shampoo, souvenir items, pre-packaged snacks, and by that they should be store-bought because they will be wiped down. Also bottles of water, cans of soda, flowers will be accepted as well, and cards, but don't seal them. Please do not seal them. And clearly leave the name of the resident that it's going to so that we don't get mixed up. This will be from 9 a.m. to 12 noon over at the COVID-19 test site, which is on the east side of the hospital, the main hospital building. Most of you know where that is now. So just mention that following Father's Day, the drop-off will occur every second Sunday. So it's going to be an ongoing issue up until this COVID-19 issue is finally taken care of. One of the prime directives of the COVID-19 task force is to take care of our elders and hopefully that they'll stay healthy and reach a healthy old age. Well, guess what? Somebody reached 100, and we'd like to congratulate Mary Dear on celebrating that, Mary Paul for celebrating that great birthday just the other day.
You had a good birthday. Very nice and very unexpected. Lots of balloons, lots of good wishes. Not for another 100 years, but 100. First 100 is enough. Really work so, huh? Work it so, huh? I'm too old. I'm too old. I'm too old now. Work it so, huh?
So happy birthday, Mary, on behalf of everybody here at the COVID-19 Task Force and on behalf of the entire community. 100 years young. That'll do it for us. So on behalf of everybody here, we'd like to say thank you for watching. Stay healthy, stay safe, stay clean, stay apart, and if you're not feeling well, stay home. On behalf of us all, niao koa nanu, onigiwahi.